Good morning, Mr. Stewart. I'm Michaela. I'm going to be your nurse today, completing your head and neck exam. How are you doing today?
Good.
Good. So this morning I've already gathered my equipment. I have my otoscope over here. I provided privacy and completed hand hygiene. I'm just observing his overall appearance right now. I'm not seeing any physical deformities. His hygiene seems to be well maintained. His skin is normal for ethnicity. He seems to be in an upright posture, and I don't see any nutritional deficits at this time. So at first I'm going to start with your head and face exam. I see that you're making good eye contact with me. You seem to be alert. Can you tell me the date today?
It's April 11th
Okay. Why are you here today?
for physical.
Okay, so he seems to be oriented ×4. At first I'm just going to look at his scalp, and I'm going to see that his hair seems to be intact, normal color for his age. Is it okay if I touch your head real quick?
Yeah.
Okay. So I don't see any evidence of hair loss. His scalp doesn't have any dryness. It seems to be well hydrated. I'm going to palpate here. Right now I'm just checking for any bony prominences that should not be there. And it seems to be smooth with no abnormal protrusions. And his face seems to be very symmetrical. His eyebrows are within the same line. His smile is not drooping. Everything just seems to be a mirror image of each other. Next, I'm going to just palpate this artery right here and feel a pulse. And that is present. And then I'm moving my fingers down here to this joint. Can you open for me? And close, open, and close. So that's a temporomandibular joint, just assessing for how smooth that was, and it was smooth. There was no rigidity there. Did you have any pain?
No.
Okay, so no pain, which is great. Next, I'm going to check your sinuses. I'll check your frontal sinus and your maxillary sinus. Any pain there?
No.
Okay, so there is no pain, there's no swelling, no signs of infection or inflammation there. Next, I'm going to move on to your eyes. The first test I'll be completing is a confrontation test. That'll just test his peripheral vision. What I'm going to do is stand right here, and I'll need you to tell me whenever you see my fingers, whenever they come into vision.
Okay. Okay. Yeah.
Okay, so his peripheral vision is intact. Next, I'm going to check your corneal light reflexes. I'll just have you cover one eye and see how it adjusts. Okay, and then the next eye. Okay, great. That's intact as well. Normally I would complete a red reflex test, but I don't have an ophthalmoscope with me right now. What I would do is have him cover his right eye. I would put the ophthalmoscope to my right eye, and then I would look through it to see his red reflection through that, and then I would follow it all the way in until I was as close, as I could do without discomfort, and then I just follow those vessels and just observe any other parts of his eye from that point. Next, I'm going to do something called the 6 cardinal positions of gaze, and so that's just going to be following my scope from one place to the next, so I can see how your eyes are moving, just testing your ocular muscles. Okay?
Okay.
Just have you look at my scope. Go here. Back to the middle. Over. Go. There we go. Alright, perfect. Did you have any pain with that?
No.
Okay. So he can gaze into each direction without any discomfort. His ocular muscles seem to be strong and working, obviously. Next, I'll just looking at your eyes, I can see, just looking at the external structure, they look symmetrical. I don't see any signs of discharge, no redness, swelling, no lesions that I can see. I'm going to look at each part of your eye here, and I'm going to pull down your eyelids. Very good. So his conjunctiva are clear and normal color. His sclera, they appear white. They're not jaundiced, no yellowing there. His corneas are nice, smooth and clear. If you can look that way, I'm going to look at your lenses here. They seem to be clear and no foreign bodies that I can see. Your irises, they seem to be normal. Have you had any changes?
No.
Okay, great. No changes in vision or anything. So his irises are the same color, they're the same size. There's nothing that's different about them that would concern me. Your pupil size is probably about 3 millimeters, and then I'm just going to shine another light in your eye to check your perla, is what we call it. Let's just look at my nose. So they're reactive to light. They're equal. Okay. Next, I'm going to have you look at my scope, and I'm going to have you follow it inwards to the bridge of your nose. All right, very good. So they converge. So perla is present, and then I'm going to do accommodation real quick as well. Look at my scope for me, and then look at the back wall. All right, perfect. So his pupils did exactly as they were supposed to, so we would say perla is present. At this time, I would use a Snellen chart, but since I don't have one here, I'm just going to verbalize that. What I would have him do is stand 20 feet away from a sign, cover one eye, and read the lowest line that he could, and then I'd have him cover the other eye, and that would give us an idea of how well his vision is. We'll usually rate it on a scale of 20 is perfect, and then it goes from there to decide how his vision is. So that just completes our eye exam. I'm going to go ahead and move on to his ears now. Okay, so just looking at your outer ear, I can see that they're symmetrical. I don't see any drainage or any redness there. I'm going to go ahead and pull on your ears, and I need you to tell me if you have any discomfort.
Okay.
How is that?
It's fine.
Okay, so usually that would indicate signs of inner ear infection, so I'm not really worried about that since he had no pain. I can see that there's no lesions, no skin breakdown on his ears or anything like that. So now I'm going to go ahead and look inside his ears at his canal and tympanic membrane. And I see that his tympanic membrane is a pearly white. It's not bulging, it's not red, so just no signs of infection, which is good. Next, I'm going to do this thing. It's called a whisper test. So I'm going to cover one ear and whisper a word to you, and then I need you to tell me what I said.
Okay.
Okay?
Apple.
Baseball.
Baseball.
Okay. So his hearing is intact. He performed well on this hearing exam. So next, I'm going to go ahead and move on to your nose. Okay. So just looking at your nose, I can see that it's a very symmetrical. It's not going one way or the other. I don't see any lesions on the outside, so I'm going to go ahead and look on the inside. Okay?
Okay.
Okay. I'm going to go ahead and test patency real quick. Can you breathe out one side? Okay. And breathe out the other? Good deal. Okay. I'll go ahead and look inside your nose real quick. So no excessive drainage. The mucosa seem to be moist and pink. The septum is not deviated. It's right in midline, and he has no problems. Excuse me. He has no problems breathing, and then his turbinates are also present there. So that completes our nose exam. I'm going to move to our mouth and throat at this time. Okay, so if I could have you open your mouth for me and look inside. Can you say ah? Okay. So his uvula is midline, seems to be very mobile. Can I have you stick out your tongue for me? Perfect. I would grade his tonsils as a 0 because I'm not really able to see any swelling or anything there. I observed his palate, the floor of his mouth. He seems to have great dentition, and his tongue, he was able to stick it out properly, so that ensures us that that nerve is intact. And his buccal mucosa, also pink, moist, and just seems like there's no complications, no redness or anything from those. Next is the neck exam. Your neck, it seems to be midline, and it seems to be symmetrical. One side is not bigger than the other. I don't see any obvious masses at this moment. No obvious pulsations. No signs of jugular vein distension. And then I'm just going to go ahead and feel around for your lymph nodes.
Okay.
You just tell me if you have any discomfort. And then down your neck. And above your clavicle. Okay, so his lymph nodes, they're movable, they're discrete. There isn't any tenderness, there's no swelling, so that shows that there's really no sign of infection either. And then I'm going to go ahead and feel your carotid pulses on each side. So his carotid pulse is present. It's strong, a normal rhythm that I can tell. And then now I'm going to check your trachea. Move that. And then if I can't have you swallow for me, I'm check your thyroid. Swallow one more time. Okay, so his trachea is midline, no complications there. His thyroid, there is no enlargement, it seems to be normal size, so I'm not concerned about that either. Can I have you move your neck from side to side? Okay, just checking those other lymph nodes. His range of motion of his neck, it seems to be intact. He doesn't have any discomfort with that I can see. And he seems to have strong neck muscles in order to turn left to right. And I believe that concludes our head and neck exam. Thank you for coming to help me.
Sure.